I'm confused as to why the British Medical Association were disappointed that GPs would be asked to work hours when people aren't actually, well, most people aren't working, so they can see more patients. Why is that a bad thing?
Yeah, so I think that obviously GPs, as part of their core contract, provide services Monday to Friday, and they have always provided extended hours. But I think the benefit of the, if you like, the new arrangements is providing appointments from 9 to 5 on Saturdays and late evening appointments during the week. Now, this would help patients in terms of whether it's sort of a normal sort of GP appointment or whether it's for screening, health checks, vaccination. But it's also not necessarily just seeing the GP. It could be that their needs are that they need to see the nurse or the pharmacist, or need the support of another health professional. And also, I think it's giving sort of what's a preference to the patient, whether it's face-to-face or a remote consultation. And I think that's important. And also be available to take 111 calls, because patients obviously ring 111, but if they need to be seen, they can also be seen at one of, it's been booked into one of these appointments. So there's a lot in there. Overall, it should benefit patients in the local population.
To it, then, do you agree it's a good idea?
I mean, I certainly think that having extended hours and having that flexibility, I think is positive because, clearly patients being able to, if they're working during the week, then to be able to access, say, at weekends, late evenings, I think it is positive. I'm pleased that it is flexible, so other health professional appointments are available. But I think it is important to provide a broad range of services because, we all have different needs and we're available at different times.
I mean, I don't know about your practice, but why is it so difficult for people to get appointments these days?
So I think that the difficulty has been exacerbated because I think with the pandemic, it's not that GP surgeries weren't open, weren't providing services. I think quite helpfully, I think patients stayed away. But what that has created is quite a lot of backlog in terms of not having had their routine checks, for example, diabetes, heart disease, and even if they had symptoms, even some worrying symptoms, they didn't seek the doctor's help earlier on. Now that the COVID pandemic is settling down, they want to get these sort of problems sorted, but that's created a huge demand. Now, my sort of thoughts is that once one covers that backlog, I think, hopefully the appointment systems will settle down. But I can certainly understand the sort of the challenging patients has in terms of booking an appointment, because obviously the demand is much, much higher than it was pre-pandemic.